You may have seen a lot of men growing facial hair this month, the month of November. It's actually Men Health Awareness Month, and we call it Movember in honor of the mustache. But they're going to be getting together at Vail Brewing Company to talk about men's health issues, and Dr. Dennis Lipton is going to give us a little preview. And even on the Today Show, they're growing it, 9 News, they're growing the facial hair. It's pretty fun, but when people ask about it, why are you doing this for? Because a lot of times these guys don't normally grow beards or mustaches, and they say, well, it's something to strike up the conversation, and it's something that needs to be done.
Right, it's a benefit for the Shaw Cancer Center to make people aware of prostate cancer, testicular cancer, and just men's health issues in general.
Yes, and a lot of times if you can catch these cancers early, they are treatable and it can really save your life.
Exactly right. So there are some screenings and some tests that men can have to sort of help reduce their risk, but prostate cancer, probably the second most common cancer killer in men. It kills about 1 in 38 men.
Wow.
And unfortunately, there's not many symptoms. So we've had a screening test called the PSA, which is a blood test, which has turned out not to be such a great screening test. So as of now, unfortunately, physicians are guided, our guidelines tell us that we are not supposed to screen the average risk man. So where does that leave us as far as trying to prevent prostate cancer? And it really is an individual thing. Like, I talk to men almost every day about this. What is my risk for prostate cancer? Should I get screened? We talk about things like family history, certainly increases your risk tremendously. And then just taking good care of yourself, regular exercise, maintaining ideal weight can reduce your risk a little bit. So we use some of those guidelines to sort of help us determine who should be screened.
Okay, all right, and then if you do need to be screened, is it
We do it, it's a blood test and an exam.
Okay.
So testicular cancer is another one, and this is generally a disease of men in their late teens and 20s. And there's not a screening test. Most men with testicular cancer, they kind of find the lump themselves. The key is if you find that lump, you need to bring it to your doctor's attention, because it is very curable and treatable if it's brought early on.
Okay, so that's the thing, and being aware of this and knowing what to do if there are some signs that you might be having it. That's the key.
Right,
and that's
bring
what
it to your doctor's attention.
This event is all about.
Right, and we talk a little about nutrition. Men generally about 2,500 calories is what they eat, and on websites such as the American Heart Association recommend up to about 6 cups a day of fruits and vegetables. Kind of a big goal, but that is what the American Heart Association has set out there as far as nutrition, and that's less than 2% of men are doing this, and it can go a long way toward preventing disease.
Yeah, it seems like women are always kind of diet conscious, but men maybe not so much. Especially they eat like they used to eat in high school and think that the calories don't really add up.
Right, and they do. And then can't talk about diet without exercise.
Yep,
Physical activity is very important. Recommendations currently are 30 to 40 minutes of moderate exercise, such as walking, most days of the week.
Okay.
What we run into with men is that they work during the week and they don't have time to exercise every day, and they try to make up for it on the weekends, sort of the weekend warrior type. Not as much benefit with that, and of course you put yourself at increased risk of injury. So really the daily activity is key. And then mental health is also an issue, and kind of surprising that mental health for men is essentially untreated depression. And it surprises a lot of people that suicide is actually a leading cause of death in men from like 18 to 35. About 1 in 5 deaths of men in that age group
especially in
is
Colorado,
from
we have
suicide.
A higher rate than the national.
Kind of screening for depression and being aware of the signs, because men don't seek treatment for those kind of things.
Okay, so we're going to have Eat, Drink, and Be Manly event at the Vail Brewing Company. And what day will you be doing the talk?
It's not a talk, it's just an event, a fundraiser.
Okay.
And it is at the Vail Brewing Company tomorrow night.
Okay, tomorrow night, Eat, Drink, and Be Manly. Have some beer along the way and learn a little bit about men's health issues. We've got Good Morning Vail coming up with the weather and, of course, Walking Mountains.